Good morning, everyone, and or good afternoon in some cases. I'm on the West Coast, so it's still morning for us. I want to thank Jen and Liam and Jones and Bartlett Learning for the opportunity to share this information with you. And in our hour together, we're going to be talking about the transition to practice, developing KSAs for career success by following these objectives in which we're going to discuss the problem, the solution, how we do it, the product demonstration, and we're going to address frequently asked questions. So, next slide. In developing this, this all started as a project, and I was working in the state of Nevada as the director of its first private school of nursing, and the state government had mandated that all state-supported schools would need to double their enrollment in order to meet the demands for new nurses to deliver services to their burgeoning population. This happened to coincide at the same time with the downturn in the economy of 2008 that we all experienced rapidly. And the outcome of that was that while the schools expanded and graduated new nurses, they were not being hired. At around 2008, there were nearly 1,000 new grad nurses in the state who were unemployed and who were continuing to work in the food, beverage, and entertainment industries as registered nurses. Being the director of the School of Nursing, it bothered me ethically that we kept producing nurses and they were not getting jobs. So the Nevada nurse leaders got together, and these are representatives from schools of nursing, employers in inpatient and outpatient settings, and other constituents who are interested in employment statistics for the state and the state's healthcare situation. We got together and we wrote a grant to the Department of Labor asking for support for help in transitioning these unemployed nurses who are still employed in those other industries to help fill the gaps that healthcare was experiencing at an enormous rate because of the influx of population and people coming into the state. The grant was funded through the Department of Labor Workforce Investment Funds, and our program was given $700,000 to take a look at career laddering and latticing in nursing. So it also incorporated the first steps into a healthcare career, which might be CNA and also other allied health professions, as well as transition to practice. Well, of all the hospitals and hospital systems in the state, there was only one system that was transitioning nurses using a proprietary transition to practice program. The rest were engaged in 1 to 3 week orientation for new grad nurses. And so taking a look at the problem statistics that we have up here, they were the same, very similar in Nevada at that time. There were an overall state turnover of 42% of new grad nurses, and they were stressed because they had experienced, we did interviews with them, and most had experienced critical incidences that created even more stress and fear, and they left their jobs, and a significant number left nursing altogether. So with that in mind, we needed to find a way to embrace these new grad nurses and help them and support them as they were transitioning into their roles with a focus on confidence, competence, and safety. So as we know in research that new nurses are caring for patients who are more critically ill, and the care delivery settings are very complex, and that there are still many nurses, new grad nurses, who are unable to participate in transition to practice programs offered by their employer because they've either worked at a place, a healthcare setting, and they're not considered new grad then, because new grad typically is defined as newly licensed with less than 1 year of experience. And then also the problem is that many nursing curricula in the final term or semester don't really provide a structured opportunity for their students to experience their role as new grad nurses. Many have set up awesome opportunities for learning with partnering healthcare agencies to do precepted experiences and to log and journal those experiences and use reflection to add value to those while they're developing their portfolio. And as a person who was an administrator of the nursing program, I was bothered by that, because I thought this is really a time when we can add the concept of patient safety in a more structured way to enhance that transition process from student to a professional nurse. So next slide. So the research has indicated that new nurses commit practice errors, and that many of the errors are linked to increased stress in nurses, and that these errors then precipitate an increased turnover, and so that creates a vicious cycle. And the outcome of this is that it impacts patient safety, and it decreases the amount of pool of nurses that we have. And we have this group of people who have made a career choice, who have invested 3 or 4 or 5 years of their life to become a nurse, and who may not be practicing as a nurse because the environment hasn't been supportive enough for them, or they haven't been grounded in their practice enough to contribute in a sustainable way. So with that, I was tasked with the opportunity to develop a program that would meet the needs of nurse employers in Nevada, and also meet the needs of transitioning nurses. So with that grant money, I developed a curriculum that is based on knowledge, skills, and attitudes, the KSAs, for success, and used established research to develop the course. The program was successful in Southern Nevada, and success in the grant was measured by recruitment, retention, and hourly wage, where the program had a 98% retention rate, and hourly wage was somewhere around $26 to $28 an hour. And keeping in mind that this was back in about 2007, 8, and 9. So the grant was funded again for subsequent years, and the program became statewide, and it was referred to as Nevada's Healthcare 2020 program. And it was funded for a total of $4.5 million. And in that time, since 2008 to 2010 or 12, transition to practice programs became institutionalized within the hospital systems in Nevada. And so many of them adopted other proprietary programs system-wide. And I'm happy to say that 1 to 3 weeks orientation expanded into 8 to 10 to 12 months new grad transition to practice programs. So I had been in contact with Jones and Bartlett as a previous author of Precepting and Nursing, Developing an Effective Workforce, and had been apprising Jones and Bartlett Learning of this program, and continued to meet with them about once a year for 4 or 5 years as the number of participants increased to 600 and 700. And I really felt confident that the project was refined and was presentable for a product that Jones and Bartlett might be interested in. So I met with them, with the organization and the publishers, and presented the project, and they used their vetting of the project, the content through peer review and decided to adopt it as a product. So the solution to the situation then is that what you're going to see today is the transition to nursing practice, strengthening the KSAs for career success. And it is a comprehensive course featuring 10 modules focused on patient safety, and it can be delivered completely online. It is compatible with various LMS modalities, and the modules are conformed to CEU requirements. The modules were developed and used the standards for evaluation to generate contact hours. So we'll talk about that later in the implementation of the model. The course can be completed within 8 to 12 weeks, and there's a full ability to customize the course to meet the needs of wherever it's going to be implemented. Next slide. Next slide. Okay. So in developing the original product, I went, you can please go back one slide. I decided that the project needed to be evidence-based, and I sought guidance from the National Council of State Boards of Nursing model and recommendations for transition to practice. And at the same time, the Institute of Medicine's landmark report, The Future of Nursing, had come out, and cues and competencies were being developed, and the Commission on Collegiate Nursing Education began to accredit entry to practice nurse residency programs based upon recommendations from the National Council of State Boards of Nursing. So these key elements, these key resources were used to develop the framework for the Transition to Practice program, and then, of course, instituting the Joint Commission National Patient Safety Goals. Okay, now we can move on to the model. So the curricular model was established using these 4 concepts, and those are the ones that are illustrated in color in the leaves. Starting in the upper left-hand corner, leadership and patient condition, moving down to patient outcomes and professional role. And I organized the model using the framework and the recommendations from each of these, the cues and competencies, the CCNE, nurse residency, the National Council of State Boards of Nursing, and tried to organize them in my mind as to how their recommendations best fit each of these 4 concepts. And then on the outer perimeter of the model are the content areas, the concept areas that are presented in the learning activities. So next slide. So what is it? So the online learning activities focus on interprofessional communication and conflict management, transcultural health, pain management, infection prevention, fall prevention, evidence-based skincare, end-of-life care, alarm fatigue, and there are others that incorporate professional development and patient teaching. Each module or each learning activity includes critical thinking activities, which incorporate knowledge assignments, which is the K, the clinical application assignment, which is the skill, and discussion topics, which are the attitudes, and also include feedback assessments and quizzes based upon the evidence-based readings that are provided. Each module is evidence-based. There isn't a textbook used for this to provide the structure, but rather current research is used to provide the initial knowledge and the basis for discussions and quizzes in the course. The resources are current and it's dynamic. So as new information comes out, the course is updated annually to reflect the changes and also new readings and resources. Links are provided to all the supporting documents and resources, and each of the online learning activities contain facilitator notes and some video vignettes. And the facilitator notes, we'll talk about the value of those in just a moment. Next slide. Also incorporated in the content or in the program or course is simulation. And the simulation activities were developed in concert with an aeronautical simulation specialist whom I met in Nevada, who worked with us for a year in refining our simulations as we worked with each student group. And I was very pleased with the outcome of this. And so all the content in simulation focuses on the two major areas, systems that are affected by most patients entering the hospital that have to do with respiratory and cardiac conditions. The simulation content includes patient charts, the simulation algorithms for decision making, peer assessment forms, and comprehensive case studies, which are worksheets to help the students prepare for the simulations. Of course, the simulations are modifiable depending upon your need as a user and also on the needs of the student. So resources supporting the simulation activities are patient charts that are linked to the case studies and the algorithms that are also incorporated with the patient charts. So the case studies are developed using an approach that forces the student into making links between pathophysiology and physical assessment. And I say forces the student because the patient or the case studies are populated in certain areas of physical assessment data are presented and or pathophysiology is presented, and they need to make the link and anticipate what the findings would be in the physical assessment if it was already presented that the patient had a certain pathophysiology associated with it. So the case studies provide an opportunity for the students to prepare for the simulation prior to the time they arrive for the simulation. And then time is used to debrief the case studies with the students so they become really and intimately familiar with the two patients that are presented in the case studies and are familiar with the lab values, the pathophysiology, and they've generated their hypotheses as to what's going on with the patient and how they're going to interact with them in the simulation. So the simulation component of this course all links together with the case studies and the actual simulations and the algorithms, and with the debriefing prior to the simulation and then the debriefing after. So the students are very, very familiar with these patients prior to the time they start the simulations and feel like they're pretty good buddies by the time they finish. Next slide. There's a professional development component that is offered with the course content, and I think many colleges and universities already have support for practice interviews where perhaps the student services department or volunteers come in and practice interviewing students or perhaps other faculty. I've developed a leadership coaching strategy that's based upon speed dating concept, and the resources to support this strategy are included with the content. The timelines, the processes, and even letters to potential panel members are generated, so all you have to do is fill in the blank and send it off. This has been a really valuable opportunity for the students to interview with potential employers, and when I say potential employers, in some of the models we use for this content, we partner with nurse employers to come in and actually interview the students, and some students who shine in these interviews are picked up as employees through this process, and others are given feedback real time by the interviewers with regard to how they can improve their presentation. Also included in this strategy are the facilitator notes for how you might do that and suggestions on how to make this a really positive experience for both the panel members and also the students. Next slide. So in the content is included the foundation documents. There are samples of syllabi, reflective journaling assignments based upon the Tanner's model for reflective thought to guide clinical reasoning and critical thinking. Assignments and content are organized in a week at a glance, and this can again be modified to however you present the course agenda. And a key component of the foundation documents is represented in the mapping of each of the learning activities and how it relates to the key element, and the CC&E baccalaureate essentials, and how it relates to the QSIM competencies. So when using these materials and taking a look at the outcome and evaluating it for program improvement and program reporting for CC&E or other accreditation, the guidelines are there and the map is already presented. The foundation documents also include a sample of a clinical log and a checklist and content integration map, so it's clear to adopters as to how this can be laid out in a model that would be used for senior nursing students or for new grads, or can be taken apart and used throughout the curriculum. All the assets are downloadable and are presented either as a course cartridge or, as you'll see in just a moment, can be hosted by Jones and Bartlett Learning on their learning management system. And again, each of these documents has facilitator notes and suggestions on their application. Next slide. So now it's time for Liam Butler to show you what the product can look like if you were to integrate it on your learning management system, and or if you choose to have it hosted by Jones and Bartlett Learning. So I'm going to go on mute and I'm turning it over to you, Liam.
Okay, thank you, Sue. Today I'm just going to give you a quick overview of transition nursing practice. What I'm showing you right now is in our LMS, but like Sue just said, it is available to be added into your own LMS. What I'm showing you is how it's pre-built, but once you have it, you do have the ability to customize it to your needs. So you can add in your own content. You do have the ability to hide or remove content that you're not using. And if you'd like to have a demo of this course, please reach out to your account manager, and then you can get a more hands-on approach and go through all the resources on your own. One thing I just want to point out is that if you've ever used any of our other courses, this one is going to be different. As Sue talked about earlier, this is more based on different evidence-based resources versus a single textbook like a lot of our other courses are. So this is a really nice way of setting up a course that's different than what we've done before. Also, as Sue mentioned, it's going to allow us to keep everything dynamic and up to date. So there will be updates to the learning activities as well as some of the other resources that will be pushed out to all courses that are using these resources. So if you scroll down here, you'll see we have the 10 different modules that are available, and I'll jump into one in just a moment. And then you see we have topics created for assessments, the case studies and simulations Sue had mentioned, as well as the reflective journal. And I'll show you what comes in each module and topic that's included. So if we click on a module, these are all the items that we've pre-built into the course for you. So if we start over here with the learning activity, this is really going to walk the students through each module and tell them what they need to do. So it's going to start with an introduction to that activity. It's going to go through the outcomes for that activity as well as just give a brief organization of how it's laid out by default. Now, once again, you can lay this out however you need to. And a lot of the resources that's mentioned in the organization here, when I get back to the main page of the course, within the module, I'll show you where students can find them. And then as we scroll down, we have the assigned readings, both required and recommended, as well as some more resources for students to go through. And then down here, they'll be able to see the discussion board questions as well as knowledge assignment and clinical application assignment. We've also built these into the course so that students can access them right within the course. They don't have to access them directly in the learning activity. And then they can go to the next page. We just have some additional questions that they can go through, some self-assessments that are down here. We do have a feedback assessment. This is built into the course as a survey, which I'll show you in a moment. And then down here we have the resources with the citations. So if we go back to the course, we do have facilitator notes. So anything you see in the course that's grayed out, that's an instructor resource. So students will not have access to it. It's something that's available for you. So each of these modules that we have will have facilitator notes, and these just walk you through, on how you can go in and teach that module. And you will find these in every topic that we have here. And then we have the quiz section. And the quiz section has a quiz that we've pre-built in that has some questions that are available. Anything that's gradable here, like the quiz, or if you want to make your discussion board questions or knowledge assignments report to a grade book, it will automatically report to that grade into the grade book. You don't have to manually enter grades if you don't want to. We have the feedback assessment. So this is what I showed you before in the learning activity. And we've pre-built a survey for the students to go through. And then if you need to, you can add additional questions if you need to do that within the survey.
Liam, this is Sue. I'd like to add on to the value of the feedback assessment. The feedback assessment was developed using the standards for determining continuing education, evaluating the product for continuing education credits. Some schools of nursing have used this in their distance learning programs as continuing education. Each of the modules used as continuing education modules, generating 3 CEU per module. And so the feedback assessment is to garner information back to present for continuing education audits. So if you're providing continuing education, you have this information that can support the participants' activities. Also, academic institutions are using this to gain qualitative feedback, because you can see is what one thing did you take from this particular learning activity that you're going to incorporate into your practice. So these are the kinds of things that you would want to include in your reports for accreditation. And also it can be used for program improvement, because if the users are saying, gosh, I really didn't find this to be useful, or there's an opportunity to include how they would like to see it changed, you may want to incorporate that into your quality review process. Thank you, Liam.
Thank you, Sue. Appreciate it. And if you do use our learning management system, you do have the ability to export these as an Excel spreadsheet. So you can get these in a very easy format that you can save to your computer. And then down here, once again, you see discussion board questions as well as the knowledge assignment that we've added in. I'll just give you a quick preview of how we set these up. So these are the questions, and then students can come here and respond to this discussion board. And then we've also added an assignment that's pre-built into the course as well. And then every module here will have readings, references, and resources that are available for the students. These are downloadable items, so when students click on it, it'll download it and provide them that information. So as you can see, as we open up each module here, it's going to have the same type of content built within each one. And then we have this assessments topic here. This is by default out of the box an instructor only resource. I unhid it so it's easier to see, but by default this is hidden from student. So these are the items. Some of these items Sue has already mentioned. So we have the assessment plan that we've built in here. We have some surveys that students can take pre-assessment, and then we also have surveys students can take post-assessment, as well as we have the leadership coaching. So this is where you would find those sample letters that Sue had mentioned earlier that are there by default, and you can just go in there and plug in the names of the people you're going to be sending it to. And then over here, we have the comprehensive case studies. So these are available to students. We do have facilitator notes for each one. So we do have a case study for respiratory and a cardiac one. And this also ties in with the simulations over here that Sue had mentioned. We do have the algorithms, for the simulations that are available. Once again, this is something that is hidden from students. So this is something that's designed for instructors to access within the course. Also, with the instructor resources that we built into the course, we do have a lot of them that are available to be given to you outside the course as well. So if you find it easier to go through instructor resources that way, that is available. And then over here, we have the reflective journal. So this is where you're going to find the foundation documents Sue had mentioned, as well as a reflective journal assignment within the course. So as I said before, this is very customizable. You can use this however you want. You can rearrange these in any order that you want. So if you just want to move things, you can come over here and there's a little move button. So if you don't teach in the order of the modules we have set up, you can do that. If there are modules that you're not using, you do have the ability to come over here and hit the hide button, and those will become hidden from students. Or if you just want to hide modules because you don't want your students getting too far ahead, you can come over here and then you can come back and make these visible when students are ready to go through them. If you want to add in your own content into the course, it's very simple. You'll notice there's a plus and minus sign down here. So if I hit the plus sign, this is going to add a blank topic into the course. I have the ability to call this whatever I want it to be. We can move it around just like any other topics. Maybe I want to add in my own syllabus in here. I can do that. Or maybe I just want to add some additional resources or content into the course. And if you want to add your own content, it's very simple. If you have, say, like a PowerPoint or an article or PDF you want to upload, just drag and drop it like I did, and it's going to automatically upload it into the course. But you also have the ability to come here, add an activity or resource, and you can add in your own gradable items through activities. And if you come down resources, you can add in your own files, link out to different websites, and you can even embed videos into the course from sites like YouTube or other video websites that are similar to YouTube. So that was a brief overview of transition to nursing practice. Once again, if you'd like to have a demo of the course, please reach out to your account manager and they can get that set up for you. So at this time, I am going to pass it back to Jen.
So this is Sue, and I wanted to differentiate. The demonstration that Liam just provided you is the Transition to Nursing Practice course, which is available on the Jones and Bartlett Learning Management System. And who might use that learning management system? Well, it could be a hospital who wants to adopt this material as part of their transition to practice or as their transition to practice program, or it might be a school of nursing who would like to adopt the material and who don't want to incorporate it on their own learning management system, or perhaps they don't use a learning management system, or it could be used by any other consumer of this particular product who doesn't have access to a learning management system. So if you do have a learning management system and that you would like the content to live on it, it comes to you in a course cartridge electronically, and each of the content areas and all the activities and things that were demonstrated to you by Liam come in this course cartridge that can be used by your curriculum developers to integrate into your learning management system and into your curriculum. So why adopt this course? Why adopt this content? Well, I think it's fairly simple to use once you become familiar with it. And it is evidence-based and it's kept current on an annual basis, which is different from a textbook, which is revised every 3, 4, or 5 years. It's comprehensive and it focuses on patient care quality and safety. And you might be saying, what use is this to our students? Because it doesn't provide NCLEX review. It can be used in combination with NCLEX review questions, but it also gives the student a focused senior nursing experience where they become integrated into the organization. One thing we did not show you was the clinical application. And the clinical applications ask the students to perform certain tasks or develop relationships within the organization as an opportunity to be seen and to be authentically evaluated by a potential employer. So we're all looking for employability and to increase the confidence and competence of the students who are going to be providing care. I'm very proud of the instructor support that is available for each and every component of this course. And I'm very confident in its value, having had more than now 700 or 800 users. The course can provide the foundation for collaboration between academia and service. And in its inception, the course was used as that bridge. It was incorporated with a partnership with 3 other clinical providers. So hospital personnel were also included in the team, the academic team, for presenting this course and ensuring quality on the hospital end. As I said before, it's dynamic and updates are sent as new information emerges. The course is completely customizable. If you were to receive it in your course cartridge, it doesn't come fixed. It can be changed and moved. You can take course content out and apply it in other courses that you may find it useful, or you can present it all in one course. And also, it provides a foundation for outcome measures, for quality assurance, and for foundational information for accreditation. Next slide. So who would use this? Well, ADN programs can use it. Bachelor of Nursing Science programs can use it. RN to BSN programs can use it because many of the RNs that we had in this program had been out of practice 3 to 5 years and were not necessarily knowledgeable of the National Patient Safety Goals and how they're used to measure nursing performance. And also it was used in an international nurse integration program where international nurses who were coming to the United States to practice were enrolled in the course, and it helped to give them an idea and flavor of what's going on more with healthcare in the United States as in collaboration with skill development. Nurse employers have used this course as well as their transition to practice program or as the bridge into their transition to practice program, which allowed them to compress their actual residency course because they were part of developing this curriculum and could see the value and sharing the responsibility for the development of the student as they progressed into their employee. And it can also be used as nurse recruitment companies to provide a standard of performance that would be useful to potential employers and partners that they would have. Next slide. So here are some testimonials, and you may wish to read these as you reflect on the handouts that you download. We can go through these quickly. So next slide, please. A nurse education director was talking about saving money by using this program. Next slide. And a student reflected on the value of this program in building her confidence and competence. This particular student had been employed as a new grad nurse and had quit her job because of stress and went back to her library job, and was captured then in our grant to bring her back into nursing. And she now is working as a nurse and is really happy with her opportunity to come back in and to work in the career of her choice. Next slide. So in presenting this and talking with many educators and employers, central questions have emerged, and so I want to go through some of these. And it says, can this product be incorporated in schools with CCNE accreditation? And this is a definite yes, because you can see the CCNE essentials and the procedure for accreditation for nurse residencies is used as a foundation document in the organizational structure of this course. So yes, there are links to CCNE accreditation. Go ahead. How many class hours are used for the online learning activities? Well, the courses, each of the learning activities has been normed to 3 continuing education credits. So it's approximately 3 hours per learning activity. And then, however, it would be integrated into your curriculum if it's used for school, would be dependent upon the number of hours you would like to assign for the clinical application component, the actual preceptorship, if that's what you're using. But the actual learning activity, the readings, the knowledge assignment generate 3 CEU, and also can be anticipating to use 3 hours. Next slide. Can the product be used in collaboration between schools of nursing and their clinical partners? And yes, and this is the original inception of this program. It was the link between the clinical setting and academia, and that's what the grant provided the dollars for, was to support that model. So it was a collaboration between clinical partners, hospitals, and an academic setting in the distance education department, and the metrics were derived from that relationship in terms of recruitment, retention, and hourly wage. Next slide. Can the product be used by hospitals as a component of a newly licensed nurse residency program? And yes, of course it can. It's because it focuses on patient safety outcomes, and that's also speaking to nurse performance and also professional development. So the framework of the program integrates well with the CCNE residency accreditation standards. So if a hospital, for instance, a magnet hospital, wanted to use this program as a component or a significant part of their nurse residency program, these materials do interface well with the accreditation standards. Go ahead. What competencies are practiced in simulations? Well, definitely interprofessional communication is the focus, and also teamwork and leadership. Standardized communication is also emphasized, and then managing patient and family dynamics depending upon how you incorporate the simulations. We also used non-paid actors as family members in Nevada to augment the experience and make it more real. And then, of course, professional accountability. So if errors were made, the students were able to reflect, or the participants were able to reflect on their performance and to be accountable for their decision making. And then, of course, clinical decision making and deciding what information is important and needed to be a priority versus what information can be used later on to support the patient outcome. So next. How might this course benefit nurse employers? Well, the nurse employers who participated in our grant described having decreased onboarding time and expense of their nurses. In Nevada at the time we were using this, the onboarding expenses for a new grad nurse were around $62,000, 60 to 62,000. So having this course allowed for them to decrease the onboarding time and therefore decrease the expense of it. The other key thing for nursing students participating in this is that they were able to know the unit culture, and working there had established a network. And this relationship building developed employment opportunities for those students. The students also knew the electronic medical record system, knew policies and procedures, because these are some of the activities that are required of them in their clinical application assignments. And it provided the employers an opportunity to authentically assess the participant performance as a potential employee, and it allowed the student or the participant to determine if they were a fit for the organization. So it was a win-win all the way around. Next slide. So it was brought up in the peer review process that the content appears to duplicate concepts already presented within various nursing curricula. And I'm saying, thank you very much. Yes, it should look familiar. The National Council of State Boards of Nursing, CCNE, CUSN, and the Joint Commission recommend that these concepts be included in all new grad transition to practice programs. And if these concepts have been presented throughout your nursing curriculum, thank you very much. But we also know that mastery occurs with repetition and increased experience. So these concepts should be repeated and used in many different contexts to incorporate mastery skills on the part of the participant to enhance their professional practice. So it should help them develop critical thinking and increase their confidence and help them become more employable. Next slide. And how does this course benefit schools of nursing? So this course can be a opening topic for collaboration with clinical partners. And this, an example, I'm working with a university right now who is using this as a tool for that purpose, to generate more interest on the part of clinical partners to expand their nursing contracts, their student contracts for clinical sites, and they're in the evaluative process right now with that. It also provides a comprehensive employment-driven approach to the senior nursing practicum. So it's taking and building upon what the students already know and giving them an opportunity to take a look at nursing performance as it's evaluated by a potential employer, and be able to achieve certain competencies within that area. One of the benefits of this program is that the facilitator and instruction support offered through the content minimizes challenges of interpretation and should promote consistency across different schools of nursing. So one educational system I'm working with has many different schools within different states, and so the content is standardized, and so they can maintain quality metrics and seek accreditation by using aggregate data from each of the schools to generate one data set. And it also helps with new faculty who are coming on board, because it's supported with instructional facilitator notes to help them understand how the content is incorporated within that university setting. It's generally easy to incorporate and use, and again, the outcome data can be used for program evaluation. So where are we going next, Jen? Next slide. So I think I'm going to turn this over to Jen now and see if you have any questions or comments.
Excellent. Thanks so much, Sue. That was a really fantastic, robust overview of the course. And I also want to thank Liam for doing, a deep dive and really walking us through the course and, the layout and the features and how you access a lot of the assets there. So if you're interested in what you see here today and you would like a 30-day trial, that is available to you. What I ask you to do is to fill out the form that we have listed at go.jblearning.com/TTP trial, stands for transition to practice. You'll also receive this link in the follow-up email. We also invite you to download the case study. So what that will do is really provide a concise overview of what Sue was talking about in the beginning of the presentation around the outcomes and, really the true driving force and the impetus that helped create this course. And if you have any questions, please feel free. Now would be the time to message me directly. We do have, I know, one question that had come in, Sue. This is, I think, a good question from a faculty member asking, would this course be advisable for a program when almost all area hospitals hire students into residency programs? They're saying that it might seem like a bit of a redundant in nature of the residency program curriculum. So would you advise using this for hospitals that hire students into these residency programs?
Well, again, the hospitals who were participating partners in the grant after they had developed their residency programs found value to this particular program. They incorporated it as almost a pre-residency, so they were able to see how the person performed with the content and with guided and facilitated experiences with the preceptor. So it was part of their kind of conditional employment. And so that was used almost as a screening tool to be able to then select those that they wanted to keep into their residency program. If it was used as part of an academic curriculum, I think it would be really interesting and very beneficial to meet with the educational staff from the hospitals that are used as clinical partners and illustrate and show them what is being taught and what the expectations are for student engagement within their hospital, and to find ways to bridge into the content that they're already teaching. And again, if it's duplicative, I think it's beneficial to new grads. I think they need to be exposed to these concepts as many times as possible, because we are talking about patient safety here, and that's the focus. We want them to be confident and competent in their role so they can provide safe patient care. So I would suggest that if you're considering this and would like to present it, maybe you have a group of the clinical educators come over and take a free trial and show them what the content is and see how it might work with their transition to practice program, which would build a great partnership between academia and the clinical partner.
Thanks, Sue. That's very, very helpful, and I hope that that answered our faculty person's question. I think it should have. I know we had an additional question that came in asking for the cost of adoption. Currently, it's a per student fee, and the cost of the course is $149. And this course is unlike other courses that might be available on the market in that the breadth and depth of content is so rich and so vast. And as Sue had mentioned, we'll also be adding to that content as well. And, there's really nothing else there at the moment that exists. And you are welcome to, in the free trial, really experience the course and how you would be able to incorporate this into your own curriculum as well. It doesn't look like we have any additional questions at this time. If any questions do come up, you can definitely feel free to respond to that email that you get post-webinar, and I can forward them along to Sue if I can't answer them here within JBL. I think we might have one more question. Okay. This is, I spoke too soon. Sorry about that. I do have one question. Have the schools of nursing that adopted this program gone away with their preceptorship clinical hours altogether? And if so, how did students bridge or transition into the workflow of the new nurse responsibilities? Did they find that the 1 to 3 month hospital orientation was sufficient?
No, the schools of nursing continue their precepted experiences, and those are extremely valuable with regard to this. And so the clinical application assignments do call for a clinical experience in order to complete those. So I would not necessarily advise this to be used solely on its own without the clinical application component. I think for people who are moving from academia into their professional role, they need to have that guided, facilitated experience within the safe environment. And it's doubly safe because the academic institution is supporting them, as well as the potential employer and the academic partner who is providing and hosting the clinical experiences. So I would not advise this to be used solely for students without the clinical component. Now, if it were used by a nurse recruiter or something like that, then I think, or the international program or RN to BSN program, I think it can be used, the knowledge assignments can be used, and the clinical assignments could be more stimulated because they do have a practice foundation. But for new nurses, no, I would encourage and strongly support a clinical partnership with that.
Excellent. Thanks for answering that question, Sue. I know that we had a few attendees asking about how they would be able to download some of the handouts that were available. We had a copy of today's PowerPoint slides as well as the case study that I referenced. Depending on if you're on a PC, you would see it in the handouts pane. That's just a checkbox that you undo, and you should be able to see the documents there. If you're using a tablet, you'll see an icon that looks like a piece of paper. If you're having still additional trouble, we'll make sure that we get those documents to you post-event in our follow-up email. So I want to thank everyone for joining us today. I also especially want to thank Sue Ulrich for spending some time with us to really talk about the true value and, the impetus behind developing this course, the outcomes, and what hospitals as well as schools can expect from their students. And thank you to Liam for walking us through the course. Again, you will receive a follow-up email. This session has been recorded and will be posted to our YouTube channel within one business day. Thank you very much, and we hope you have a good rest of the day.